how you might talk aloud about your own thinking with a student, even with something that seems as simple as a child coming in with a sore ear or a patient presenting with a quote-unquote stomach ache. How would you share that thinking about thinking with your student?
Sure. Well, clinical reasoning, one of the things one needs to recognize about clinical reasoning and illness scripts or heuristics is that it's very context dependent. So, for example, if you're in a smaller rural community and over the course of the last number of days you've seen a number of people that have had gastrointestinal illness, a viral gastroenteritis, for example, and someone comes in complaining of diarrhea, well, you've already kind of got that context that would suggest that this is actually a viral gastroenteritis. So you might jump to that diagnosis fairly early in your interaction with the patient. And what the experienced physician will do is conduct a very focused history to rule out that it's something different than a viral gastroenteritis. And when he satisfies himself that he's not missing something or making a diagnostic error, jumps to the diagnosis of viral gastroenteritis and then jumps to management. Having that context perhaps makes it easier for the student to recognize that you're going through an illness script by doing this. But certainly, I think the teacher can explain, first of all, the context of the community experiencing viral gastroenteritis, and then going through the thinking process of what you need to rule out when you're dealing with abdominal pain and diarrhea. So you have a few questions in mind that rule out perhaps red flags, for example. So the clinician will ask, do you have blood in the stool? Well, blood is a red flag, and that's one of the things you rule out. So you kind of going through that filtering process, and what you want to do is think out loud for the student to recognize that filtering process.